Serious, doctors of Reddit, what is the rarest disease that you've encountered in your career? I diagnosed a patient with cancer of the parotid gland. It has an incidence of less than 1%. It went something like this. He came to me because he was having right jaw pain. I assessed him and nothing was really out of the ordinary. I thought he was having some TMJ because he had been dealing with some stress and he did have pain at the TM joint. A week later he came back with a Bell's palsy, which is a temporary paralysis of one side of the face. This can be caused by inflammation or a viral infection. So I asked the appropriate questions and he had some upper respiratory symptoms the week before. But something was off, so I palpated his jaw again and moved more medially towards his cheek. And he said it was painful midway on his cheek, where his parotid gland was. There was something there, not a discernible mass, but something was off. That's when I ordered a CT scan, and it was confirmed. I got him to a head/neck specialist along with getting him to a cancer specialist. He's currently 2 years out, and although he's missing some of his face due to surgery, he's doing surprisingly well. And his spirits are great. Dermatologist here. Some fun ones: chrome hydrosis, where sweat comes out in different colors. My patient's was blue, argyria, a permanent discoloration from silver overdose, aquagenic urticaria, an allergy to contact with water. Rarest disease that I've seen in my career thus far would have to be leprosy. It's something that one hears about in antiquity and something I read about in books, but I never expected to actually encounter it in my career. I worked with a physician who presented with VCJD, mad cow disease. He didn't like to talk about it, and who could blame him? But the staff who worked there at the time said the patient would call repeatedly, up until they were able to get into a neurologist, and would just say, "Help, something feels weird." VCJD is fatal, so management was all palliative and it was super rough on everyone. Dental student here. Our periodontics professor told us that she diagnosed a teen boy with Papillon-Lefebvre syndrome. It's an extremely rare genetic disease. 1 in a million person gets it. Very, very rare. It's characterized by the development of dry scaly patches on the skin of the palms and the soles, palmar-plantar hyperkeratosis, in association with severe inflammation and degeneration of the structures surrounding and supporting the teeth. I came across a patient with Chattyakagashi Syndrome. My case, fascinating to see/work with, as it's very rare and we just see such cases in dentistry books. Veterinarian here. I recently adopted my patient, a stray kitten that had been scrotal transposition, aka genital dysplasia associated with XY disorder of sexual development. Basically, his penis and testicles switched places. We neutered him and now he's normal except he has no sheath to his penis. Rarest? Off the top of my head, I don't know. I did see a woman with psoriatic arthritis type 5. It's an autoimmune disease. It had basically disintegrated all her fingers to nubs. They had the exact shape of short, stubby sharpened pencils. Edit: I think it's called distal interphalangeal predominant psoriatic arthritis. And the pics I googled still don't do it justice. She looked like she had sharpened pencil stubs for fingers, like strange little claw hands. I was an intern at the time. The woman laughed at my amazement. She was obviously comfortable with it at this point. I've talked about this on here before, but I had a glioblastoma patient whose tumor grew right through his skull. Because it grew out and didn't put much pressure on his brain, he didn't have any symptoms until he was combing his hair one morning and felt the tumor just sticking right out the top of his head. GBMs aren't very rare, but I only know of one other case in the world where it grew through the skull. Still makes me touch my own scalp every time I think about it. Well, I've had several doctors tell me my condition was rare. I have Bell's palsy, which is partial facial paralysis, and mine's on the left. It's usually common to be temporary, but mine isn't, and I've had it since I was just about a year old. Dentists to eye doctors have mentioned it and politely phrase their "oh wow" moment after I say I've had it since I was a baby. I had a patient who presented with purple/silver skin. He looked like a Smurf and the Silver Surfer had a baby. However, he was in the ER for abdominal pain and was highly offended when I asked him about his skin pigmentation. My first impression from across the room was that he was severely hypoxic, and I was amazed he was walking and talking. He made comments that made it appear he was a huge conspiracy theorist, so I was suspicious of colloidal silver toxicity. When I asked him about it, he shouted angrily, "I don't take silver supplements anymore." After some prying, he said he took them to self-treat for a prion disease, which he self-diagnosed from the grape juice test, where you spit out grape juice into a petri dish and a fungus grows out of it. At this point I'm like, yeah, this patient is fucking nuts. I'm pretty sure he listened to too much Alex Jones and as a result permanently dyed his skin blue, a condition called argyria. I have blepharophimosis, which means my eyelids weren't fully developed when I was born. Lab tech, not doctor, but hypereosinophilic syndrome. It's probably the only thing I've seen once. I've dealt with a handful of malaria cases, which are rare here in the US, Some more rare cancers that have allowed me to see hairy cells, harlequin cells, and mast cells in peripheral blood, and some rare diseases in animals from my time in a veterinary reference lab like inclusion body disease in snakes. There was also a case where an internist wanted to send out to test for some rare Bermudan virus of some kind that would have cost thousands of dollars, but seeing as the patient went on a Bermudan cruise some years prior and it was flu season, we were able to talk them down. But you never know. I also had a doctor who was convinced that their patient was positive for both Hep B and Hep C because the test for the Hep B core antibody read as Hep B C antibody. Boss. Medical professional here. Without revealing too many details, as I don't believe anything has been published on the patient, yet, 60-something-year-old male presented to the ER with decreased vision in his right eye, a fairly common complaint that can be due to several different factors. The patient got a head CT which was normal and was discharged. Patient returned a few days later with no vision in his right eye, fairly uncommon. Additional CTs were done of his head and neck with contrast, helps show the flow of blood in the vessels. Turns out the patient had significant calcification within his coronary arteries. Tiny flakes of these calcifications were breaking off and being transported through the head and neck vessels, right to his ophthalmic artery, causing irreversible blindness. None of the doctors at this facility had ever seen or heard of a case like this, hence my saying nothing has been published yet. There were several different articles in several different areas being written up on the poor guy last time I checked. Fibrodysplasia ossificans progressiva, FOP, a disease that calcifies soft tissue and turns it into bone. When I was a medical student, our group's cadaver had this disease. During dissections we sometimes would get poked by spiky pieces of bone in random areas of our body. Also had a spine that resembled a small turtle shell. In my first ever human dissection, aged 19, we found out the guy I was operating on had situs inversus. Basically everything was on the wrong side, compared to an average person. Heart on the right, liver on the left. Left lung was the bigger one. I really thought I had messed up somehow or forgot the absolute basics of anatomy. Eventually I called over the lab supervisor and asked her if that was normal. She was giddy with excitement. We don't really have access to the person's medical records, but it's possible they lived their entire life not knowing their internal organs were a mirror image of everyone else's. I have hairy cell leukemia, kinda rare and usually men get it. I'm female. I have a rare heart condition. It's called inappropriate sinus tachycardia, and it basically means that my heart is faster than average. My resting heart rate is around 104 BPM. The cardiologist said that he could count on one hand the amount of times he's diagnosed the condition. For anyone curious, it feels like you always just finished walking up 3 flights of stairs, or when you're anxious right before an exam, a kind of jittery exhaustion. Harlequin ichthyosis. In med school there was a baby born with this. Basically their skin scales up and peels, removing that very important barrier, so kids born with this don't live long. She was just a couple months old and had not yet left the hospital since birth. Patient admitted for something unrelated, starts deteriorating for no discernible reason, has some mild generalized abdominal pain, but other than that no specific symptoms. However, he keeps worsening to the point where he's barely hemodynamically stable. On the abdominal contrast CT, there's fluid everywhere. Organs pushed against the abdominal wall. Just one enormous gray puddle from the top of his pelvis to his diaphragm. And then, at some point, there's a scribble of white pretty much smack dab in the middle of it all. In this context, signifying active bleeding, it was shaped like the world's smallest firework pop, and it was nowhere close any major vessel. Everyone was dumbfounded for a hot minute. It turned out to be a spontaneous, a traumatic rupture of the cystic artery. No surgeon in the building had ever seen one. Dude underwent embolization and made it out completely unscathed. Gorham's disease, aka Vanishing skull syndrome. A softball-size area of my patient's skull disappeared and left behind a soft spot. She ended up with a plastic plate to protect her brains. Crazy disease. Thanks for listening. Subscribe for more daily videos.